Hello, we are Team MCR for the Hack for Rare competition presenting on Desmoid tumors. Desmoid tumors are a rare tumor affecting 0.3% of all cancers. They typically do not metastasize, they can invade local tissues, exhibit aggressive growth, and have a high rate of recurrence. They typically do not cause death except when they involve vital structures. However, they can be painful and can considerably degrade quality of life. In this track, we're tracking an individual patient. It's a 36-year-old female with a mass on her back. There is an 11-year period where this tumor has been present. The past therapies have included non-pharmacological options such as surgery, ultrasound, and radiation therapy. Pharmacological options have included NSAIDs and a variety of chemotherapies, including sorafenib, Doxil, and methotrexate. These have had some degree of success, however, they've all had some side effects, and they're not good long-term options. The sequence of therapies this patient has followed has been conventional based on published literature. However, we're at the end of the conventional sequence of therapies, and we're now entering the investigational therapies area. So typically, desmoid tumors are caused by a mutation of the CTNNB1 gene, which encodes for beta-catenin protein. This is 85 to 95% of sporadic desmoid tumor cases. Also associated is a mutation of the APC gene, which can be associated with familial adenomatous polyposis. Dysregulation of this pathway leads to a nuclear accumulation of the beta-catenin. So this patient does not have a mutation to CTNNB1 or APC. However, they do have an accumulation of beta-catenin in the nucleus of the desmoid tumor cells, so there must be another cause for that. So we're looking at a variety of other signaling pathways: estrogen, mTOR, Notch, JAK-STAT, Hedgehog, and KIT. And then for each of the pathways that we propose, we do have specific mechanisms in mind for how they can affect cancer and tumor growth. So we'll kind of jump through those real quick. Ultimately, what we have, though, is a series of suggestions for tests that the patient could take. So this is immunohistochemistry or real-time PCRs, checking for the presence of a variety of chemicals, and if the chemicals are present, they would indicate a certain therapy. So each of the pathways has a potential therapy based on the testing that we present here. So past testing that has been done is the whole genome testing, and this is something we do recommend other patients also follow. However, we do recommend that if that is non-conclusive, that we extend it to include the immunohistochemistry or the real-time PCR. These are the specific tests that we recommend for those solutions to identify which pathways might be relevant. And here's a summary table showing the individual drugs that might be relevant based on the results of those pathway tests. So upcoming, we would like the patient to undergo the testing we propose. We think that this patient would be a good candidate for a case report since they're a unique class of patient where conventional genetic mutations are not present. And long term, we believe that other people could benefit from this as far as therapy selection when they also do not have the typical genetic mutations for desmoid tumors. Thank you very much.